Hello, this is Dr. Do again. This video is continuously on alphabetic list of problem on letter G. Today I'm going to talk about gallbladder and gallbladder diseases. First of all, is there any emergency situation associated with the gallbladder diseases? Of course, acute cystitis, acute gallstone blockage causing the inflammation, and even it's very serious. It could be life-threatening if the stone or block the bile duct, cause this block the cyst ducts, cause the gallbladder pressure rising up, and then could be perforated, causing the diffused peritonitis, and which is really life-threatening. So these are the emergency. What are the signs? Abdominal pain, the right upper quadrant, severe abdominal pain. You feel guarding, and also probably associated with jaundice, yellow of the skin. And there's a special sign called Murphy sign. You can put your right finger, you put your thumb on the right upper quadrant and your deep breath. If you cannot do that, or if the guarding is really seriously guarded, feel like you cannot do it, that means it's really positive. Murphy sign is acute cystitis is really the condition you need to see the emergency as soon as possible. Is there anything you can manage at home? Actually, unless you do not know, or unless the gallbladder is not inflamed with full of stones, but it's really need to be followed up very closely. So this is basically, if it's diagnosed as the gallstone, probably it's a good idea to take it out, or if diagnosed as a cystitis, also need to be treated. I think the radical treatment is surgery, but there are some indications that can be managed conservatively with medication, antibiotics, but usually it's the good idea to just take the gallbladder out surgically. So anyway, let's talk about more about this gallbladder. It's quite common. So gallbladder, we know the function of gallbladder. We all know it's affiliated with the digest of fat and absorption of the lipid. So in terms of the, we all know the gallbladder is stored with the biles. The biles is synthesized in the liver along with the meal, and then some of the bile go into the duodenum, which that's where the fat will further digested, absorbed, and part of the bile will go back to the cyst, to gallbladder, to store there. So, and then there's their bile duct system. There the duct system to induce those biles or transport those biles to the duodenum. So there's a left and right liver duct, and also there's a cystic duct, and together they merge to the common bile duct, and also along with the pancreatic duct, together they opened at the duodenum. There's a structure called ampullae of the Vater, which is a circulatory enlarged smooth muscle serving as a band, can open it up or can close it up. So if after meal, for example, it's going to open, and then the pancreatic duct transfer all the enzymes secreted from the pancreas, the amylase, the lipase, and the peptides to digest the three major compounds, and also the bile also flow in to digest the lipids and fill it with the absorption. So this is about the fundamental knowledge of bile duct, and the pancreas associated with the food absorption. So what kind of pathological conditions, what kind of disease associated with bile or with the gallbladder? You all know it probably. First of all, it's stone, because the full of lipids, cholesterol can tend to attract calcium to be calcified, becomes the stones. It could be asymptomatic, as a matter of fact, unless the stone fell, blocked the duct, or the stone or inside of the gallbladder caused severe inflammation. I had this kind of experience seeing the gallbladder fill with the stones like a sack of sand. You can feel that way. So this is because of this stones cause acute inflammation, then undergoing the surgical radical treatment. So before the acute inflammation, these stones not just accumulate in one day. So the 3 feet of ice cannot be formed by one day. The same idea. So the stone in cyst or gallbladder is not by one day. It's a long-term accumulation or asymptomatic. So unless it's inflamed or the stone stuck, fell, and lodged at the duct, blocked the passage. That's the situation we just mentioned. The emergency situation, as I mentioned at the beginning of this video. So having talked that, I have mentioned the symptoms. Usually it's right upper quadrant abdominal pain, maybe feel cramp, or if it's a chronic, then just the chronic pain associated with fat food intake. If it's acute, then the pain is really seriously constant pain, and on top of that constant pain, feel like a spasm, make it worse. So this is the first symptoms, and also the first symptom also may or may not associate with fever, nausea, vomiting. Usually, if it's the stone also blocked the liver duct, that causes the yellow, the jaundice. And also there's Murphy sign I already mentioned. This is for the physician to diagnose as one of the criteria, the triad for this diagnosis of acute cystitis. So anyway, in terms of treatment, it's very straightforward. Usually just surgical remove it, because if the stone is there, and if you had a stone, even though take the stone out and leave the gallbladder there, there's a trend or tendency to recurring of the stones, inflammation. So usually it's just remove the gallbladder to just for the long run prevent the complications. So anyway, and then let's talk about the prevention. So talking about serious condition, I do see the perforated gallbladder. It's very life-threatening, because gallbladder, the content leaking out in the intra-abdominal cavity, that's a very serious condition, cause a lot of damage to the tissue. So that is the so talking about the severity of the condition, talk about the causes. Let's talk about the prevention. Probably it's obvious to you. Just the weight reduction, limited really the fatty food, and also make sure eat a lot of vegetables, eat regularly, so can decrease this cystic inflammation or cystitis or gallstone. So anyway, this is, I think it's very fundamental, medical related. You probably already know it. Just for a remind, if you know it, healthy diet is always good, always helpful for many diseases to prevent. And also exercise, of course, lose weight is another important strategy to prevent the gallstone or acute cystitis, because usually the gallbladder acute cystitis associated with those tend to overweight people. So anyway, you probably know it. If you know it, then this video will serve as a reminder for you. Just watch your diet, watch your weight, and exercise. So that is all for today. And thank you for watching. I will see you next time.